Hi, I'm Dr. Jill Smith. I'm a clinical psychologist and I work in Nyack, New York. Most of the clients who come into my office are struggling with issues of depression, anxiety, life transitions and changes in their lives or in their relationships. I blend the psychodynamic and the cognitive behavioral approaches. It varies from client to client. I tend to use the cognitive behavioral approaches a little bit early on in a relationship with a client when they're feeling ambivalent about sharing things from their past, or when they really don't have the language to explain how they're feeling. They can't identify their emotions. They have difficulty identifying what their thoughts are and why they're thinking a certain way. Depression is very treatable. Especially when people are willing to do something about it. It's hard, especially for people who have been living with depression for a long time, it's hard sometimes to treat it themselves. A lot of people try, and I call it Band-Aids. So if someone goes shopping and they feel better for the day, that's great, but it doesn't necessarily get to the underlying problem of why they're feeling so depressed. I see a lot of men in my practice, and a lot of them have been socialized to keep their feelings to themselves, to really their only acceptable emotion for a lot of men is anger. And they really haven't identified other emotions. It all comes out as anger. But their typical ways of dealing with that anger is not working anymore. So that's what we work on in therapy, is to identify that there are other emotions underlying that anger and that there are ways to change how they're feeling and make them feel better.